There were some 1,420 new cases of COVID-19 reported yesterday. All cases were locally acquired. That means that we currently have 14,410 active cases of COVID-19 in Victoria. It's with great regret that I have to report that 11 people have lost their lives with COVID-19. A woman in her 70s and 2 women in their 90s from Whittlesea, 2 women and a man in their 70s and a man in his 80s from Hume, a man in his 70s from Moreland, a man in his 70s from Hobson's Bay, a woman in her 60s from Darebin, and a man in his 50s from Casey. Can I take this opportunity to pass on our deep condolences of all Victorians to the families, friends and communities of those Victorians, and just say again, any life lost is a tragedy, but COVID deaths just bring a particular poignancy to this global pandemic. Currently we have 525 people who are hospitalised with COVID-19 in Victoria. 94 of those people are in intensive care, with 53 on a ventilator. Of those people hospitalised yesterday, some 66% were unvaccinated, 28% were partially vaccinated, and 6% were vaccinated. In regards to tests, a daily record of 71,451 tests were done yesterday, bringing now to over 3 million tests since this current outbreak commenced. In regards to vaccines through state-run clinics, 36,542 vaccines were administered in our state-run hubs, and well into the 90,000 pluses across all of the platforms in Victoria, and more than half of the nation's vaccines yesterday were delivered in Victoria. In regards to vacancies right now for vaccines that are available just by getting onto our state clinics, we'll have more to say about that. But in regards to the percentages as vaccines continue to rise in the Victorian communities, we make our way towards the 70 and 80% double dose gateways. We are now sitting at 83.8% of the 16 and over population of Victorians having received a first dose of the COVID-19 vaccine, and 54% of the population having received their full double doses. And there are still plenty of vaccines available, appointments, not just in our GPs, not just in our community pharmacies and others, but also at our state-run clinics. In terms of first dose appointments, over the next 7 days, there are some 8,000 Pfizer appointments on the books now for Victorians who are still yet to book in to do so. There's some 5,800 AstraZeneca vaccine first doses available, and as a result of more Moderna and a highly effective mRNA vaccine being made available from the Commonwealth, we now have some 28,000 new Moderna vaccine slots available. And it's important to also remember that as a result of the changes from the Commonwealth in regards to allocations, Pfizer is now also available for over 60s at GPs and primary healthcare clinics. I'll get Jerome to speak more broadly about this shortly in terms of the details, but as I say, Moderna as a mRNA vaccine that has more recently come on to the nation's vaccine, the Commonwealth's vaccine rollout, has now been more widely made available in Victoria, not just in community pharmacies, but now being made available to the state-run clinics. And I would encourage anyone to get that safe vaccine and do their bit to make sure that they get Victoria through those 70 and 80% double dose vaccination gateways as soon as we possibly can.